Hello, everyone. My name is Anthony Tioli. I'm a physiotherapist working in private practice in Rosemere, Quebec, in Canada. I'm a PhD student in rehabilitation science at McGill University with a focus on knee osteoarthritis research, and I'm the president and founder of InfoPhysiotherapy. Today, in collaboration with BF Formation, I'll be providing a brief research summary of an article published in 2018 entitled Pain and Functional Trajectories in Symptomatic Knee Osteoarthritis Over Up to 12 Weeks of Exercise Exposure. So first, we'll go over what they did in the study, then we'll go over their results and how those results can inform our clinical practice. First and foremost, this was a prospective cohort of 171 participants with symptomatic knee osteoarthritis that were taken from a randomized trial that was comparing 12 weeks of Tai Chi to 12 weeks of physical therapy. They analyzed weekly WOMAC pain and function scores using group-based trajectory models. And for the purpose of this study, they actually pooled both groups because they found no difference between the 12 weeks of Tai Chi and physical therapy. So they pulled them together to increase the power and precision of the analysis. And what the authors found was that they identified 4 different trajectories in a cohort of 171 participants. The first trajectory were those who had lower initial WOMAC pain scores but demonstrated an early improvement with respect to exercise. That was 43% of the cohort. Then there was those who had moderate initial WOMAC pain scores and also demonstrated early improvement. This was about 32%. So what we're seeing here is about 75% are demonstrating an early improvement, and they started off with lower to moderate pain. Then the third trajectory is those who had a higher pain level but demonstrated delayed improvement, which was about 15% of the cohort. And the last cohort was those who demonstrated a higher initial WOMAC pain score, but no improvement with respect to the intervention. And essentially what this tells us is that no 2 patients will respond exactly the same way to any one intervention. So we have certain individuals who respond quicker, some that might take a little longer, and others who don't respond at all. So this is important. One key message I think that this study tells us is that most participants actually experienced improvements following 12 weeks of exercise exposure. So this needs to be communicated to our patients, and it's information that can be used to reassure and encourage them to continue exercising. There are also subgroups within the study that initially demonstrated greater baseline pain and physical disability, and these individuals demonstrated either gradual, delayed, or no improvements at all with respect to exercise. So I think this kind of makes a case for intervening early in the OA population and getting them moving early on, rather than letting things kind of progress and then the pain starts to increase and and it starts to affect them a little more and more functionally. I think if we can intervene early on, the knee will be a lot less sensitive and will be able to and they'll respond a lot better to exercise as well. Some other key points: 10% of the patients in the cohort didn't respond or didn't improve with exercise. And in clinic, we need to find out why. So what were the limiting factors? Were the participants not doing the exercises? Were there certain pain-related factors that were causing an exacerbated response to exercise? So exercise-induced hyperalgesia. Were there certain psychosocial factors or perceptions and beliefs that were a limiting factor in terms of exercise adherence, in terms of if they believe exercise will help them or not, and whether or not they believe that exercise is damaging to the knee. So these are all things we need to address right out of the gate with our patients. There were also 15% of the participants had delayed improvement. So I think this is important for managing our patient expectations. I think when we talk about providing exercises to our patients, we know that the resulting improvement, if any, is a process that can take time before improvement is seen. So it's not something that just happens overnight. We don't just prescribe exercises and the next day people are cured, for example. It's a process that takes time, and this needs to be communicated to patients. If you're interested in learning more about knee osteoarthritis, you can head over to infophysiotherapy.com and bfformation.com. I've written several blog articles on a variety of topics regarding knee osteoarthritis that you can read. I'd like to thank you for listening today. I hope you found it useful. If you have any questions about knee osteoarthritis or you'd like to reach out, you can do so via social media at InfoPhysiotherapy. We have a Facebook page, an Instagram page, and Twitter as well. I'd thank you again, and have a great day.